Welcome back. New ways to reduce some stubborn fat, and doing that without surgery and without pain or any downtime. It sounds too good to be true, but it is. Here with more on that, plastic and reconstructive surgeons Dr. Payman Danielpour and John Layke are here. Welcome back, guys.
Doctors.
Well, so when we're talking about this, what are some of the traditional ways that people address that extra they want to get rid of?
Traditional ways have always been surgery. I mean, that's
that was
really
the only alternative.
Like liposuction?
Liposuction, liposculpture. And basically, the difference between those two are just the volumes of the amount of, definitely.
Aggressive, invasive. What's the new way? What are we talking about here?
The new way, and the new way we try to do everything nowadays is less downtime, less pain. People scared of surgery. People think surgery is bad. We're plastic surgeons. We really like to operate, but we found something that really works, and this is the Layke cool sculpting technology, which really targets fat cells by freezing them. So by freezing the fat cells, we take them to a temperature where we can actually make them so-called die, and they go away. So it targets fat cells specifically, and it does something very similar to liposuction, just not as aggressively, with really no downtime and no pain.
When it goes away, meaning what? It's flushed out in your system. It gets in. It just it goes somewhere.
Absorbed.
It's absorbed into your
by the
system.
body.
Okay.
Yeah, you know.
So it's called cool sculpting. We have you brought along a little video that helps explain this. Can you talk us through it? Okay.
Definitely.
All right.
So as we talked about, fat cells have a different freezing point, and so cool sculpting, what it does is it selectively targets and freezes these cells, and it triggers your natural immune response for the cell to die. And then your own immune system really comes through and selectively removes those cells. Now, it doesn't take away all of the fat cells, but you can see approximately a 25% reduction. Usually, the results can be seen over the course of the next 6 weeks to 3 months, and we've seen inches taken off.
Can you repeat this process and it continues, or once you freeze those fat cells, there's no more left there to freeze?
Sure, you can repeat the process because it depends how much fat you have, depends how much you want targeted. Well, like John was saying, about 20 to 30% gets taken away the first time around. You maintain your diet and exercise regimen, and if you don't have enough that comes off, well, 3 months, 6 months after you do this the first time, you can come back and do it again.
That.
Does it come back? If you eat and you don't take care of yourself, does it come back?
These, again, if you maintain your current weight and your diet and exercise regimen, these fat cells are permanently removed. Now, we don't remove all of them, just 25%.
Let's just mention too, this is FDA approved,
Absolutely.
right? Yeah. So this obviously went through a lot of rigorous. Different protocols before you were actually able to use it.
Okay. All right. So let me see if I got this right. A lot of cold onto the skin that's so cold only the fat cells react to it. Is that right?
And the skin is fine.
And it's gone.
Doesn't get burned.
Is there any risk? Is there any other things to be concerned about with it?
I think there are there are minimal risks, and usually what patients complain of most is there's either a numb feeling or there's a little irritation and redness, sometimes some swelling afterwards. Very rarely will you have just a little bit of discomfort immediately, but nothing that that lasts longer than a week or two.
Can we go? You brought Katie, and this is Katie. Introduce us. She is a office.
Yes, she's our assistant.
Okay.
Works at the office, and
she's going to demo this for us, or she's going to allow us to.
She has kindly offered her services to.
Okay. Well, she's going to get into position, and you brought some befores and afters, real life. So while she gets settled in, let's share with you at home.
We're going to talk about these before and afters. First one we're going to show is outer thighs that were targeted with a cool fit. There are multiple different probes. This was the cool fit. As you can see, the before and after there, it shows about a good 20% to 30% reduction, and this was shown 3 months after. Here's the love handles that we show. Big common problem that people can't get rid of, and it's clear as day. You can see the difference of the hourglass shape that now is seen in that before and after. And last, but not least, is the abdomen and flanks. And this was multiple probes in multiple sessions, and they were done in the abdominal region and in the love handle flank region. And you can see there, 3 months after, there's a really nice result there without any contour deformities, as you can see sometimes with liposuction.
Is there any discomfort to the patient at all, or is it minimal?
Let's see.
We'll find out.
Okay, no, I'm talking afterwards, because you were saying...
No, it all depends. Now, depending on where you target, love handles and flanks, never. I mean, I really go that far saying never. Sometimes the lower abdomen, they will have some discomfort for about a week to 10 days. And when I say discomfort, it's just Tylenol, Advil, we'll take care of it.
Oh, okay.
And that's it. It really is that simple.
Let's go ahead.
We've asked Katie to go ahead. We put a microphone on her so she can actually tell us what she's feeling as she goes through this process.
Please.
And explain to what you're, take us
Sure.
through the
You
procedure.
know, ultimately beforehand, what we'll do is we'll take a certain area. You need a pinch in order for this machine to work. And so really what I'm going to do now is apply, this is probably the worst part, it's a cold gel pad that really allows the probe to have
I'm already
better
out.
contact.
Sorry, I'm already out. I can't handle it. She puts her cold hands on the back of my neck every day.
Yeah, he does.
All right, so what are you doing?
Now, I'm applying this suction probe onto the targeted area. So again, this is the love handle region. And what I'm going to do is apply the suction device. And as you'll see, everything was now sucked into the machine, and this is the particular area being treated.
Now, Katie, what are you feeling?
Just feels like a little bit of pressure, but nothing that I can't tolerate or anything like that.
It looks like what I used to do when I was a kid. I would take the vacuum hose and I would stick it to my cheek.
That's how it feels.
It would please.
You still do that.
I should have been a plastic surgeon,
But
clearly.
let me, this isn't anything you think, oh, I'm going to apply cold and it'll go away. People can't go home, put it in a plastic bag, zip it up and put it on your belly. It's not like that, right?
No, that's not going to work.
No, I mean, because people will think, oh, that's all I have to do is put cold things on my stomach and I could get rid of my fat. That's not how it works.
Again, this is brought to a selected temperature that is specific for targeting fat cells.
All right.
How long does it have to stay there for a treatment?
Per area, it stays on for 1 hour.
Okay. And then
Need a
somebody
magazine?
would.
Normally we do, an iPad or TV with a movie, and they sit there
And
and
they
watch,
can
or
hang
watch a
out.
book, or read a book, or do your texting or phone calls while you're in the office. The other thing you could see is you asked for the targeting of the freezing, but this is also sucking in that area that we've marked, so it's targeting specific fat cells that are being brought into this canister. So by putting an ice pack on yourself, it's not going to.
Is not going to do that. Now she would normally, or your client would flip over, patient would flip over. You do the other side.
Absolutely.
Yes. And you could do this. How long do you usually do short sessions, or will somebody come and have the whole thing done?
It depends. We have patients that come in and they'll spend the whole day there. So it'll be 6 hours, 7 hours, targeting different areas. And it's not something that would preclude you from doing multiple areas. Again, with minimal downtime and minimal discomfort, you can really target most of the areas all in the same day.
How expensive is it?
Normally speaking, there are different probes. There's a small and a large. The small, and the company basically sets a price for everyone. So there's no price gouging or competition, so everyone gets it the same. $750 for small areas, $1,500 for large areas. And like I said before, one treatment normally does help. People that are bigger and require more, sometimes we tell them, listen, liposuction is probably a better idea for you because you're going to need too many sessions. It might cost you too much.
It's just they get you across the finish line. You work really hard and you just can't get out. You can't do. I know it's only been on for a second or two in terms it would be an hour, but can you remove that? Can we see what it would look like underneath?
Sure. How do you feel right now?
Feel good?
Yeah? No tingling or anything? Do you feel cold?
Yeah.
You do feel the cold from it, but
So now we gently remove the
Oh,
probe,
I see. Yeah.
and you can see the area where the suction has been performed. And
Right.
so really, as this stays on for an hour, we liken it to almost a frozen stick of butter. And then afterwards, you simply knead or massage that area out just to make it nice and smooth.
will it only work what's underneath there and get it, or not in the peripheral of it?
Yeah, and that's the
Just
whole
with the
thing.
red.
It's in the area that we target. So you come in, we get that pinch. You have to have a pinch. If you don't, it's not going to work. But you get that pinch, you mark it out, and it will target this area. And as you saw in the before and afters, it really gave you that hourglass shape because we targeted the right areas.
Well, I already know you did your tummy, and it looks great, by the way. So you already went through the procedure once before, and so now
Yes.
Fantastic. If you'd like to know more about this, go to BeverlyHillsPlasticSurgeryGroup.com and you can get some more information on
You have
this.
a card?
That's wonderful.
We're forming a line.
Are you forming a line?
All right, we're forming a line to Sandy Dung. She's up next.
Hey guys, that's right. Well, we've got the latest trends in watches and one of our all-time bestsellers, plus a lot more. So come back for Hollywood Steals.